My name is Bob Gerlach. I am the Health and Welfare Benefits Manager here at Wespath, and I am very happy to be talking to you today about HealthFlex that is going to start for you on 1/1/2025. A couple quick things. One, as I said, I am recording this so that those who are not able to attend can view it later. I also have it set up where cameras are off. That keeps the file small. Uh, I also have microphones off right now. If you would like to use the chat to ask questions during the presentation, you certainly can. I will address those as I see them or as it fits with the slides that are upcoming. And then at the end, we should have plenty of time. I can take the mics or give you back access to your microphone so that you can ask your questions verbally if you'd like. The last bit of housekeeping is right now I'm going to post some materials in the chat that you can download that I'll refer to during the presentation. And then finally, you will see when I go through the presentation slides for what are called benefit bites. These are actually short videos that we have prepared that are going over what I will be covering in subsequent slides. We'll make the links to those available to you if you'd like to look at them later. They don't work too well in Teams or Zoom or whatever avenue we use for a webinar, largely because they're housed on YouTube. And so we can't control if and how many ads are going to pop up. So it tends to disrupt the presentation. They're there so you're aware of what the video is called, but they are pretty self-explanatory. And once you go out on the website later to take a look, I think you'll be able to know which one goes with which section. So I'm going to turn my camera off and go ahead and get started. As I said, welcome to HealthFlex. Very excited to be offering this for all of our friends at LaGrange College next year. I will go through all the different plan options, starting with medical, dental, and vision. Talk about the premium credit, which is really the cost share between you and LaGrange College for the purchase of the plans. I'll talk about health accounts that we have available. Decision support tools, because as you'll see, there's a number of different options available to you. And then I'll walk through a little bit on how you'll make your HealthFlex selections, and then we'll have time for questions. Right now, I'm posting the documents in the chat. The first document there, 5258B, is the HealthFlex plans comparison, and that talks about all the different medical, pharmacy, behavioral health plans. Those are combined into one plan for each. We've got dental, we've got vision, health accounts. All of that is listed in this brochure. In addition, on the front cover of the brochure, we have some coverage and payment terms available for you. Most of these are pretty standard insurance terms, or certainly health insurance terms. Premium credit is a little unique. That's what we call the cost share that LaGrange College is giving you towards the purchase of your plans. Then we've got HMO and PPO, the two types of plans we offer. The HMO is really just a dental plan. All the medical plans are PPO plans. And then we've got the different health savings and reimbursement accounts that are available. HealthFlex offers high-quality partners in our plans. So we have Quantum Health for care coordination. This is key. I'll talk about care coordination in a couple slides. We use OptumRx for our pharmacy benefit management, VSP for vision, Cigna for dental, MD Live for telemedicine, and Health Equity is the one who handles our health accounts. And we have broad network access. So every single combined medical and behavioral health plan use the same Blue Cross Blue Shield PPO network. And then all plans for pharmacy use the same OptumRx premium formulary and the retail pharmacy network. We know that for many people, one of the most important things to you is finding out if your doctor is in network. To do that, you could navigate to bcbsil.com. We contract through Blue Cross Blue Shield of Illinois because Wespath is located in Illinois, but we use their broadest national network. Basically, that means if your doctor is in any of the local blues, they will be in this network. Navigating and finding an in-network doctor is fairly simple. The one key piece of information you need is number 5 here to make sure you select participating provider organization PPO in brackets. That gets you the largest network in Blue Cross, which is the one that we use. And then some examples of the major hospitals in the area of LaGrange College that are in network. Those include Wellstar Hospital, which is also known as West Georgia Medical Center. It includes Piedmont Noonan, Piedmont, and Grady. So those were as I understood, the 4 biggest hospitals in the area, and they are all in network. With the number of plans that we have, we really have done it to tailor options that fit you and fit a wide variety of people. So we have 6 combined medical, pharmacy, and behavioral health plans. I'll show you those in a moment, up to 3 dental plans and 3 vision plans. And this allows you the flexibility to personalize to your unique situation, whether that's how many people you have covered, your current health status, financial risk tolerance, and financial preparedness. And to help you choose the plans, we have Alex Benefits Counselor, which I'll talk about later, a prescription drug pricing tool, the plan comparisons, like I have added to the chat, and then detailed plan materials that are available online, things like the benefit booklet where you could find durable medical equipment or some more unique features of the plans. All HealthFlex plans have care coordinators, and I'll talk about them in a moment, but they're a team of nurses, benefits experts, and claims specialists that are there to help you through your healthcare journey. And then all plans have the same well-being programs and incentives. I won't go into great detail on any of those. You'll get more information on them in January once you've joined the plan. That's when we send out all the well-being program information. But 2 things I wanted to highlight. The first is that each covered participant and covered spouse can earn up to $410 each for activity screening and wellness credits. And then beginning in 2026, you will have a higher deductible if you do not take the health check in 2025. And we'll communicate about that. You have until, I think it's the end of August, to do the health check questionnaire. It's completely anonymous other than us knowing that you've taken it, and then we use the responses to help design future plan enhancements. So that's what we use that for. Care coordinators. They are really like having a knowledgeable family member available to you when you have questions about your healthcare. So you can check benefits before a service. They can find an in-network provider for you. When you're at the provider's office or the pharmacy, you can call and get immediate answers about, where to get a certain prescription, or if it's going to be covered, or what, how close you are to your deductible. They'll help you understand the cost of a service and how it applies to you, whether you've met your deductible, if you've already hit your out-of-pocket max. If you get a bill or an expense, they will explain to you why the charge is what it is. And they will happily answer questions between your provider and the insurance and keep you out of it. Their phone number will be on the back of your card. You can see highlighted here. It might be hard to read. The same number there for care coordinators and RX member services. So one number to call for medical, pharmacy, and behavioral health. Health accounts, dental, and vision would be separate, but the care coordinator is where you go for medical, pharmacy, and behavioral health. And they are available 8:30 to 10, 7 days a week, Eastern time. The provider can also contact the care coordinator. There is a provider services number on the back of the card, which you can give to your provider if they have any questions about billing, about is something covered, do they need eligibility verification or pre-certification? They can do all of that. And the goal is to keep you out of the middle and let the plan and the provider speak to each other. We have 5 areas of focus for our well-being programs. Again, this slide and the next couple, maybe just 2, highlighting what you will see in January when we start communicating about these programs. So we focus on emotional well-being, physical activity, improving your diet, improving your sleep, living with chronic conditions, and more. The one key thing I want to point out here is in the yellow the yellow logo there, Personify Health on the left. That is going to be the new name of Virgin Health, who you may have heard of before. They're going through a rebranding. So you might hear references to Virgin Pulse. It is Personify Health. And you will hear more about that, as I said, in January. Okay, so now I'm going to go over the HealthFlex benefit options that we have for you to choose from. We have 6 combined medical, behavioral health, and pharmacy plans that are represented by apples in a number of our publications. So let me walk you through what the apples signify. You can see here that they have 3 different colored apples. We have the gold apples, the silver apples, and the bronze apple. The color of the apple identifies where the premiums fall. So the gold apples are those with the highest premiums, the bronze with the lowest premium, and the silver in between. Each apple has a leaf on it. The 3 HSA plans have a green leaf that show that they're paired with a health savings account. The 2 C plans, named because they used to be called CDHP plans or consumer-driven health plans, have a blue HRA leaf because they are paired with a health reimbursement account. And then the B1000 has an orange leaf with no letters on it because that is not paired specifically with a health account. And then in the middle of the apple is the plan name. And I'll talk more about the details of those plan names and what the numbers signify in a few slides. There's up to 3 dental plans available. The reason I say up to 3 is that the dental HMO is a zip code driven plan, which means it is not available in all areas. We have 3 vision plans, and we have multiple health and reimbursement account options, the HSA, the HRA, a healthcare FSA, and a dependent care FSA. So the way that all plans work is they have a deductible phase where you pay everything until the deductible is met. And when I say everything, I mean the discounted cost of any services. Once you hit the deductible, you enter the co-insurance phase where you pay a portion and the plan pays a portion. You can use money in a health account during both the deductible and the co-insurance phase to help you meet those thresholds. And then once you hit your out-of-pocket max, which is the same in all plans of $5,000 for an individual and $10,000 for a family, you don't pay anything towards covered services. The plan pays everything from that point on. There are certain services that have copays, and sometimes they're due before or after the deductible is met, but never after the out-of-pocket max has been met. And since the copays fix your cost, meaning you are paying a portion and the plan is paying a portion, they technically bypass the deductible in that way. Therefore, they do not count towards the deductible. And this chart only applies to medical, pharmacy, and behavioral health and covered expenses in those plans. Non-covered expenses and dental and vision expenses do not apply to the deductible or the out-of-pocket max here. There are many things that are included exactly the same in every plan. So you can go to the doctor or provider of your choice without a referral in any of the plan types. You have full access to the nationwide Blue Cross Blue Shield PPO network, which is their largest network. You have access to the same premium formulary medications regardless of which plan you choose. All plans give you access to care coordinators. All plans cover the same medical services and the same prescription drugs. So you don't have to worry that if you choose one plan over another, a covered drug would not be covered. All the same. And then the same comprehensive well-being programs and incentives are also covered. There are some differences between the plan types, and you'll see these are kind of grouped into types here. The B1000 in orange is a traditional PPO plan. That is the only plan that has a fixed copayment for doctor, urgent care, and ER visits. In an HSA plan or an HRA plan, you must meet the coinsurance, or you must meet the deductible until coinsurance applies. For medications, it changes up a little bit. For the B1000 and the HRA plans, you are not required to meet the deductible before the copayment or coinsurance for medications apply. But due to IRS rules, you do need to meet the deductible before the copayment or coinsurance apply, unless it's a preventive medication. And I'll talk about that more later. Behavioral health office visits are different across the board. In the B1000, you have a fixed copayment, which does not apply to the deductible. In the HRA plans, because there's no health savings account paired with those plans, the IRS does not care if we offer those visits or coinsurance for those visits before the deductible is met. So we do that. In the HSA plans, however, the IRS says that you must meet your deductible before the plan can pay for a portion of those visits. As far as health accounts go, the B1000 does not have a health account built into it, but you can make personal contributions to an FSA. For HRA plans, you'll see in a moment that they have employer money built in that goes into the HRA. Only employer money can go into that plan. So if you want to make personal contributions, you can do so within an FSA. And then for the HSA plans, you can make your own contributions to an HSA. We'll talk about this a little bit later, but if you are going to max out your HSA and also want to contribute to an FSA, you can, but that FSA would be limited use. There's actually a handout in the chat on that, but we'll talk about it a little bit more later. So when we look at the various plans, you can see the plan name listed across the top from H2000 with HSA on the left to B1000 on the right. The number in the plan name is the individual deductible for that plan. And then if you double the number in the name, you get the family deductible. For the C2000, for the H5000, the C2000, the C3000, and the B1000, each person only needs to meet the per person or individual deductible before the plan starts paying and you enter the coinsurance phase. The family deductible can be met collectively. In the H2000 and H2500, for those plans, if more than one person is covered, you have to meet the full family deductible before the plan starts paying. For all these plans, for all the green plans, the HSA plans, the deductible applies to medical, behavioral health, and pharmacy. In the blue plans and the orange plan, so the C2000, C3000, and B1000, the deductible applies to medical and behavioral health, but not to pharmacy. We look at the next row, you can see the coinsurance that applies. The H2000, the C2000, and the B1000 all have 80% coinsurance after you meet the deductible. That's the percentage the plan pays. The H2500 has 70% coinsurance after the deductible is met. The C3000 has 50% coinsurance after the deductible is met. And then the most unique plan when we talk about coinsurance is the H5000. That is called that is what's known as a deductible only plan. So once you meet the deductible, you've also met the out-of-pocket max. So it's 0% coinsurance. meaning it's 100% coinsurance for the plan and 0% for you once the deductible is met. And as you see in the last row, every plan has the same $5,000 individual out-of-pocket max, $10,000 family out-of-pocket max. All of this information and more are included in that HealthFlex Plan Comparisons 2025 document. That is 5258B in the chat. When you compare plans, a couple things we want you to think about. Just because a plan has a higher monthly premium does not mean the plan is better. Each plan has the same quality and services covered. In our analysis that we do every year, it's been consistent that over 90% of people in HealthFlex would save money in an HSA plan. So some considerations to potentially help you save money in 2025. When you look at your costs for services and what healthcare is going to cost you in the coming year, don't forget to consider how much you pay each month in premiums. For many people, the most expensive part of healthcare are the premiums each month, certainly before the cost share in the form of premium credit that you receive. An example I have for this, I'll use my household. So myself, my wife, and my daughter, who's 12, are covered on my plan. And my daughter, who's 12, plays sports, and she's in locker rooms and jams a finger every once in a while or gets sick. So if we go to her doctor's office in the B1000, that would cost $30 for that visit to just go to the doctor's office. And I would be paying hundreds of dollars a month in premium between the H5000 plan that I'm in versus the B1000. If I go to her doctor and pay out of pocket, it's about $120. So I would be paying hundreds of dollars a month to save $90 on a visit. Not cost effective for me. If we look at urgent care, in the B1000, urgent care has a copay of $100. In the H5000, the last time I went to urgent care, it was around $175 or $180. So again, many hundreds of dollars a month in premium to save $90 or so, $80 or so in one visit. If you want to get a better estimate of what you pay to go to your doctor, or if you've gone to urgent care, you can look at your explanation of benefits that your current provider should be able to show you, and that will tell you about what it would run as in our plan as well as what you've had to pay. And then you can use Alex to help estimate those future expenses and get a recommendation for health account contributions, and I'll talk about Alex more later. And then I mentioned in my specific scenario that I save hundreds of dollars in premium each month by choosing the H5000 over the B1000. One of the ways that I'm able to have money when I need it to go to the doctor is I use some of those premium savings to make a contribution to my HSA, and that way the money is there when I need it. We have a couple other things in the HSA plans to help you save money. The first, and I'm going to walk through examples of how this works, are that we have preventive drugs, the list of drugs that the IRS says we can pay for or pay our portion before meeting the deductible. So we have that activated on our plans, meaning that copayment and coinsurance apply before you meet the deductible in HSA plans. But it's got to be what's considered a preventive drug. OptumRx manages that list. We have that available online. You don't need to go to this specific URL. When we look at a couple of the documents later, there's a QR code included in those. And when you get your annual election postcard in the next week to week and a half, that will also have a QR code where you can get at all this information. The other thing we have is pretty unique. Not every plan does this. We actually give you credit for manufacturer's rebates at the point of sale. So usually the plan at the end of the year, or it's really on a quarterly basis, gets rebates based upon which prescriptions were filled. So through our PBM, the rebates come to us and we apply them to offset premiums because HealthFlex is not for profit. What we've done is we've instructed OptumRx to apply the guaranteed portion of the rebates to your purchase when you're at the pharmacy, which reduces what you pay at pharmacy. And then if there are additional rebates after this that come at the end of the year, we then apply those to rates to keep those costs down. The prescription drug cost is one of the more complicated portions of the plan. So I'm going to walk through, I think it's 9 or 10 slides here that I hope do a good job of breaking this down. We also have videos on these, the Benefit Bites videos that are available on our website if you wanted to go back and look later. So there's 3 different categories of prescription drugs, and there's different costs associated with those categories. So the first is generic. Those are medications that use the same active ingredients as brand name drugs. They're taken the same way. So if it's a pill, it's a pill. And they offer the same effect, but usually cost much, much less. Preferred brand drugs, many are not available in a generic form, but they're more cost effective than the more expensive alternatives and than specialty medications. And then non-preferred brand are the most expensive brand name drugs. These are usually the ones you've seen a commercial for. It includes specialty medications, and they're less cost effective than preferred brand drugs. Within the plan, we have, we're a mandatory generic plan, meaning if the generic is available, we ask you to fill it. But if the generic doesn't work for you, right, the drugs are usually the same active ingredients. Sometimes they have a different inactive ingredient that means that it doesn't work as well for one person over another. It's usually, less than a couple % of people who fall in those categories. But if a generic doesn't work for you, if a preferred brand doesn't work for you, your doctor can talk to the care coordinators and submit the appropriate documentation, and then you can get that other prescription drug. Let's look at the cost of medications here. So I'm going to start with a drug that's a generic non-preventive medication. So you could see the difference in the B1000, C2000, and C3000 compared to the HSA plans. So these are real medications. I don't have the names up here, but these are the actual discounted cost of the medication that I'm going to show you first. So this is not what it would cost if you went without insurance, right? Because just by having insurance, you get a reduced cost, and that's what I'm going to show you. So the full price of this generic medication is $110 for a 30-day supply, $330 for a 90-day supply. In the B1000, C2000, and C3000, the copay for a generic medication is $10 for a 30-day supply and $25 for a 90-day supply. Now, there are some extremely inexpensive generic medications that are like $2, $3, $4, $5. If the actual cost of the medication is lower than the 10 or the 25, you would pay that. We're not going to upcharge you on those. Since we're calling for this example, this medication is non-preventive, it means that in the HSA plans, you must meet the full deductible before the plan pays its portion. So before you meet the deductible, you pay that full discounted cost of $110 or $330. If it's a preventive, once you've met the deductible, though, in the H2000 and H2500, you would pay the 10 or the 25. And in the H5000, once you've met the deductible, you would pay $0 because that is a deductible only plan. And once you've met the deductible, you've also met the out-of-pocket max. Now, let's say this exact same drug was on the preventive drug list. It is a preventive medication. So in the B1000, C2000, C3000, you pay the same because we're already in those plans bypassing the deductible. The deductible doesn't matter towards pharmacy costs. In the H2000 and H2500 or the H5000, though, even though you haven't met the deductible because it's a preventive drug, you pay the same as you would in any plan. So if your prescription, and you'll see this as a theme as we look at the other two different categories of prescription drugs, if your drug is on the preventive drug list, it does not matter which plan you choose. It will cost the same in all plans. Now we'll look at the preferred brand. So the next most expensive, that middle tier. This, again, a non-preventive medication. So this is an actual preferred brand drug that goes for $267 for a 30-day supply or $726 for a 90-day supply. In the preventive brand level of drugs, we have coinsurance of 70% with a minimum and a maximum that apply. So you can actually view this in the 5258. This information is on page 7, but in the preferred brand drug, so you pay 30%, the plan pays 70%. We have a minimum and a maximum. So the minimum you would pay for a 30-day supply is $30. The maximum is $65. For a 90-day supply, the minimum you pay is $75. The maximum is $165. So you'll see here that this for this drug, the maximum applies. So even though 30% of 267 is 80 some dollars, I think, off the top of my head, you would only pay 65 because you're going to pay the max. Or for a 90-day supply, it's 165. Again, in the HSA plans, this is non-preventive before the deductible. You pay 267 or 726. If you've hit the deductible in the H2000 or H2500, you would pay the 65 or 165. If you hit the deductible in the H5000 again, you pay $0 because it's that deductible only plan. And then similar to what we saw with the generic, if the drug is on the preventive drug list, you pay the same across all plans because in the HSA plans, we get to bypass the deductible. So the third example now is non-preferred brand, the most expensive, and this is the non-preventive. For this, we're looking at a drug that costs just under $1,700 for a 30-day supply, just under $5,000 for a 90-day supply. Just so you know, this is a pretty inexpensive non-preferred brand drug. There's some that go for $30,000, $50,000. There's drugs out there that cost $1 million a year, but they would all fall in this category. So in this scenario, you pay 40%, but we have a $50 minimum or $120 maximum for a 30-day and $125 minimum, $300 maximum. Again, in 5258B, that brochure that I have on page 7, you would see all these details. So here we are again in the B1000, C2000, C3000, you pay the maximum. So it'll be $120 for a 30-day supply or $300 for a 90-day supply. In the HSA plans, you pay the full amount until you've met the deductible. For the H2000 and H2500, once you've met the deductible, you pay the $120 or the $300. And then in the H5000, if you meet the deductible, you've met the out-of-pocket max, so you pay $0. And then similar to what we saw in the other examples, if this is a preventive medication in the HSA plans, you bypass the deductible, so you pay the same regardless of what plan you're in. We do have some rules in place to promote adherence and cost savings in the pharmacy portion. Pharmacy is the fastest growing expense in the entire healthcare industry. So we use the OptumRx premium formulary across all the plans. For maintenance medications, those drugs that you take every single day, we limit you to 3 30-day fills, and then at that point, you must transition to 90-day fills. And this is purely cost effective. There is some adherence in that people, when they have the medication on hand, are more likely to take it. And if they have a few months versus 1 month at a time, they're definitely more likely to take it. For those 90-day fills, you can use OptumRx home delivery, where you'll get them mailed every single quarter to your home. Or if you want to use retail pharmacy, you can use Walgreens for that. Now, this is just for maintenance medications. Any other one-off medications, you can go to any pharmacy that's in the network. I have yet to see any of the big box grocery stores or Walgreens, CVS, Rite Aid, any of those, Walmart, that are not in the network. And many, many, many mom and pops are also in the network. We have prior authorization, step therapy, and quantity limits as recommended in place. If you need an exception, there is a way for your doctor to do that. I recommend having your doctor work with the care coordinators on all of that. And then an additional benefit that's really there for the outliers. We have a couple dozen people in the whole plan who fall in this, where we have a patient advocate for complex cases. So household with many medications, including some that must be temperature controlled, certain very critical specialty meds, things like that. There is a patient advocate at OptumRx who can help you. If you feel you need that, I would recommend talking to the care coordinator and OptumRx to see if that is something that makes sense for you. I'm going to move now to dental plans. So we do have 3 dental plans: the passive PPO, the PPO, and the DHMO. The DHMO is a dental HMO which uses a very, very narrow network that is not available in all areas. When you go through and choose your plans, if you see the DHMO, it means it is available in your area. If it is not available in your area, you won't even see it as an option. Both the passive PPO and the PPO use the same Cigna PPO Advantage network. That's one of their larger networks. The DHMO does not have a copay. The passive PPO and PPO do have a $50 copay, but it doesn't apply to cleanings or x-rays. The DHMO has a charge schedule that we have listed in the benefit booklet if you wanted to see it. Whereas the passive PPO and PPO use co-insurance similar to what we have on the medical side. 80% co-insurance on the passive PPO, whether you go in or out of network, 90% in network on the PPO, 70% out of network. And then whether you go in or out of network in the passive PPO, it's a $2,000 max benefit. So that's the max the plan will pay in a year. For the PPO, the dental PPO, as it's also called, it's a $2,000 maximum benefit in network, $1,000 out of network. So really, if your dentist is in that Cigna PPO Advantage network, you're going to get the best, richest benefit in the PPO. If they're out of network, you're going to get the richest benefit in the passive PPO. And then no ID card for the passive PPO or PPO. You could print your own or pull it up on an app for your dentist. They usually only need that information once. For the dental HMO, when you choose that plan, you have to also choose a dentist. It's the only plan where you have to choose a primary provider. Each person in the household can have a different dentist, and you'll get an ID card with that dentist's name. You can change your dentist in that plan as often as you like. You'll get a new ID card when you do, and it's always effective the first of the following month. There's a handout that I have in the chat on finding your in-network dentist. So pretty straightforward. You can find whether your dentist is in-network for the DHMO or the Cigna DPPO Advantage. And again, all these details are in that 5258B, the plan comparison for 2025. We have 3 different vision plan offerings. All of them come with an exam with a $20 copay or additional amount if you need retinal photos and diabetes eye care. You can find your network provider on vsp.com. No out-of-network benefits on the exam core. There are out-of-network benefits for full service and Premier, but I will say they are pretty significantly reduced. The exam core is what it says. It's really an exam only plan. You can get a discount on glasses and contacts in that, but no allowance. Whereas in the full service vision, you get a $160 allowance towards glasses or contacts each year, and that's each covered person on the plan. In the Premier plan, you get $200 towards glasses and contacts or 2 pairs of glasses, and that's each covered person each year. For the full service and Premier, that allowance is reduced if you go to like a warehouse such as Costco, or if you go to Walmart, because they tend to buy discontinued frames in bulk. So they reduce the amount that the plan will pay towards those. And then lens enhancements, full service, the progressive lenses are covered automatically. In Premier, they are also covered, as is UV protection. And then if you want anti-reflective coating in the Premier plan, you can get that for a $25 copay. Vision benefits do not have an ID card. You can print something out online after January 1, but every time I've gone to the eye doctor, I just let them know I have VSP and give them my SSN, and they look me up. And like the other benefits, all the vision benefits are in the plan comparison brochure. So now I'm going to talk about premium credit. This is really the cost share that what we call the cost share that LaGrange College gives you to purchase your plans. As I'm sure you know, when we look at the different plans, the premiums vary by plan and by who is covered. The premium credit is the cost share that LaGrange College has put in place, and it can vary by how many people in the household are covered, but it does not change based upon what plan you choose. Think of it as a gift card you're using to buy your coverage. It only applies to medical, and when I say medical here, I mean medical, pharmacy, and behavioral health that are all rolled into one plan, dental and vision premiums. It does not apply to personal health contributions. Once you've exhausted your premium credit, if you have purchased plans that cost more than that premium credit, you are responsible for the difference. And you're responsible for any personal contributions that you're making. If you do have extra premium credit after choosing your plans, you do not lose that money. It gets deposited into an HRA or HSA on a monthly basis, and it goes into an HRA or HSA depending upon what plan you chose. Got a couple examples here that I'm going to walk through. In this example, this is a single individual who gets an $800 a month premium credit and chooses a $1,000 a month health plan, chooses a $40 a month dental plan, a $0 a month vision plan, and chooses to contribute $100 a month to their healthcare FSA. So the premium credit is $800. The total premium is the $1,000 plus 40 plus 0 for $1,040, which means that the participant pays $240 towards their plans plus the $100 for their FSA for a total of $340 a month. This next example is for someone who is covering themselves and one other person in their household. They receive a premium credit of $1,650. The medical plan costs $1,500. They choose no dental and a zero-cost vision plan and choose to make a $300 a month contribution to their HSA. The premium credit is $1,650. The total premiums across those three plans is $1,500. So they do not pay anything for their premiums because the premium did not exceed the credit. They do pay the $300 HSA contribution, and then they get another $150, which is the excess premium credit, deposited into their HSA. So they will pay $300 a month and get $450 into their HSA. The breakdown of all the premium amounts based upon the premium credits are going to be sent out by Lori either today or tomorrow so that you have those. Of our 6 plans, 4 of them come with account funding built in. So if you look at this chart on the far right, the B1000 does not have an employer contribution. The B1000 is the most expensive plan we have from a premium perspective. The H5000 is the least expensive plan we have. That one also does not have an employer contribution. For all the other plans, you can see that if one person is covered, there's an amount that's deposited. And if more than one person is covered, that amount is doubled. This money is available on day 1 of coverage for you to use. It is not prorated. And every year that you are enrolled in the plan, so long as the plan stay exactly the same, that amount would be deposited into a health account for you. If you want to put your own money aside in a health account, in the HRA plans and the B1000, you would do so in a healthcare flexible spending account. HRAs can only take in employer money, not personal contributions. But for HSA plans, you can make personal contributions, but the IRS limit that's in place applies to all the money that goes into that account. So your personal contributions plus any included employer contributions. Health savings accounts are a great way to pay for medical expenses with pre-tax money. You can accumulate funds over time to use for your healthcare when you need it, including saving for future expenses, including retirement. The amount of employer contribution is available in full for claims on January 1st in this scenario. And as I said earlier, approximately 90% of people in HealthFlex would save money and pay the lowest amount in one of the HSA plans. Some comparison on the health accounts. The HSA IRS limits here, if you're only covering yourself, it's $4,300. If you're covering more than one person, $8,550. And if you're over 55, you can contribute a flat extra $1,000. So that brings it to $5,300 or $9,550. There is no limit on an HRA. It's only what the employer or plan puts into the account, not your personal contributions. And the FSA, the amounts listed here, you can contribute a minimum of $300, a maximum of $3,200, but we do expect that to go up. The IRS has not yet released the healthcare FSA 2025 limits. Of course, eligible dependents for this varies based upon the plan. For an HSA, all dependents claimed on your tax return, you can use your HSA for, whether they're on the plan or not. For the HRA, you can only use the HRA for services of dependents who are covered by HealthFlex at the time of the service and at the time you had the HRA. And on the FSA, it's tax dependents under 27 at the end of the year, and that's whether they're covered under the plan or not. The HSA and HRA have no limit on what can be rolled over from year to year. The FSA in 2024, it's $640 that can go to the next plan year. We are also expecting that to go up when the IRS announces the 2025 limits. That will probably be by the end of the month or early November when they announce that. The HSA money is yours no matter what. Once it's there, as long as it wasn't deposited in error, that money is yours and it rolls over in perpetuity. For the HRA, it also rolls over. The only time you would forfeit that money is if you terminate or waive HealthFlex. So if you terminate your employment or you waive your coverage, then we'll give you 90 days to spend it. If you retire while covered and you have a balance, we let you take that balance into retirement. And then on the FSA, if you terminate or waive your coverage, you can only use the money that's there on claims while you were covered in the plan. So if I'm covered in the plan through the end of this month and I go to the doctor in November, I cannot use the FSA for November because I'm not covered in the plan any longer. Interest and dividends, the HRA and FSA do not have anything, but the HSA, once you reach $1,000, you can choose to invest money, and depending upon where you choose to invest and how it performs, interest and dividends could be available. And then just some other notes here. For the HSA, you do need to accept the terms and conditions. Due to the Patriot Act, you may need to send some identification to confirm who you are. We largely see this in individuals who use their maiden name at work, for example, but legally they're using their married name, or maybe using a nickname at work that's in our system versus your full name. Not very common, but pretty easy to rectify. With the HRA, if your balance falls below $100 and you're no longer in a plan where you would receive an HRA contribution, so let's say I have $75 in my HRA and I choose an HSA in the next year, we're going to ask you to spend down that $75. We'll give you 90 days to spend it. We do not want to pay more in fees than the money that's in the account. And for the vast majority of people, spending $100 on healthcare is pretty easy to do. And then for the FSA, 100% of what you've elected is available on January 1st. For the HSA, if you're making personal contributions there, that money is only available once it's been deposited, because that's a true bank account. And then if you are thinking about contributing to an FSA and an HSA, I do have a handout in the chat for that. Unlikely that many people fall in that category. For the vast majority of people, you would not want to contribute to an FSA unless you've already maxed out your HSA. Here's a couple just scenarios of where you might want an HRA or an HSA. For the HRA, if you are approaching Medicare eligibility within the year, or you're already enrolled in Medicare Part A or receiving Social Security, you most likely do not want a health savings account. There's another handout in the chat. I think it's called something like HSA considerations when approaching Medicare eligibility. That's going to lay out the scenario of why you would not want to do that. And then in the HRA plans, remember we talked about how the prescription drug co-pays apply before the deductible is met. So if you have a lot of prescription drug costs, but not really a lot of medical costs, it might be more beneficial for you to be in an HRA plan because you have that copay without meeting the deductible first. And then HSA is really the crux of this. Is if you need to save for future expenses, if you have the ability to put money into your HSA, or if you're going to always hit your out-of-pocket max and want to get that tax-free, the only way to really do that is to contribute that out-of-pocket max to the HSA. So that's why the HSA would likely be best for you. Here's what these handouts look like that I spoke about: the approaching Medicare eligibility and the considering an FSA with an HSA. Those are two handouts that are in the chat. They're also available online. They do a much better job explaining the scenarios than I could. And then, like all the all the different benefits we've seen up to this point, the health account options are in that plan comparisons document as well. That's that 5258B. For the health accounts, if you elect a health account or a plan with a health account, you will get a Health Equity debit Visa card. I don't like that it says debit on there because you actually process it as credit. But it's a white card with the purple Health Equity bar at the top and HealthFlex on the upper left. And it's the same card regardless of which account or how many different accounts you have. If you only have an HSA, all eligible expenses, medical, pharmacy, behavioral health, dental, and vision, will pull from that card. If you have an FSA or an HRA, the same eligible expenses pull from that card. But if you have an FSA and an HRA, since the HRA rolls over indefinitely and the FSA only a certain amount rolls over to the next year, it will always pull from the FSA first. And that's so that you don't lose any money. And then for the handful of people who have an HSA with an FSA and or HRA, the HSA is always going to pull first for medical, pharmacy, and behavioral health. And then if you haven't met your deductible, it will only pull from dental and vision. Once you've met the deductible that's defined by the IRS of $1,650 if you're covering yourself or $3,300 if you're covering 2 or more people, you can let Health Equity know. And then if you have money in the FSA or HRA, you can use that for medical, pharmacy, and behavioral health. They just have to flip a switch. And that's something that they would have to do every year. The last health account we have is the Dependent Care Flexible Spending Account. There is no card with this account. This is for childcare. Think of it like daycare and summer camp or adult dependent care. You can contribute anywhere from $300 to $5,000 annually. You cannot be reimbursed until the money is actually in the account. So a monthly share goes in on the 5th of the month and is available. And as I said, you don't have a debit card. You can submit a reimbursement request online or via the app, or you can have a check cut to the provider once it's in the account. The 2 main resources we have for you to make an informed decision would be Alex Benefits Counselor, which I'll talk about in a moment, and the How Do I Choose My HealthFlex Plans brochure. So that is 4915 in the in what I've posted, although I don't see it. I don't see 4915 there. So I'm wondering if that did not get posted. I will add it at the end if it's not there. That brochure includes a QR code where you can get to the AE site and get all the information that we've discussed today and more, including the videos that are available. And Lori just put in the chat that she has hard copies of that in HR. I will say that brochure, it's a half a page booklet. It is much better hard copy than it is in a PDF. So if you want that, I would recommend you getting that from Lori in the HR department. So Alex is available now for annual election. He definitely does a good job explaining benefit concepts that could be confusing using more simplified language. It takes about 30 minutes to complete. I think that's accurate. You could certainly take longer if you go through and try multiple different scenarios. You'll get a personalized recommendation for which plan is the lowest cost for you based upon what you've input and what health account contributions you should consider making. It definitely has lively graphics. It definitely has animation. And for humor, I would call it kind of dad joke humor. So you're not going to be laughing out loud like a comedy show at everything he says, but it's at least lighter when we're talking about complicated scenarios. Alex is going to know what your premium credit is, but only if you make the right selection here on this page. So for you all, you would want to choose lay employee working at a church or other location. Within HealthFlex, we have a lot of annual conferences of the United Methodist Church that participate in our plan. So the vast majority of individuals covered in our plan are clergy. So that's why we have that listed here. But for you, it is definitely lay employee working at a church or other location. Once you input what your expected utilization is, Alex is going to crunch the numbers, focusing on the premium credit, and what your estimated costs are using national averages. Alex is going to give you a comparison side by side of the top three and show you which plan is likely to be the lowest cost for you. Alex is also going to show the worst case scenario. Now, I want to warn you, when you go through Alex the first time and go through and tell Alex what your expected utilization is, Alex is not going to, at that point, apply your premium credit, not going to apply the cost share coming from LaGrange College. What you'll need to do is you continue on until you get to the premium credit module, which is a couple modules later, and then Alex will know what your premium credit is and be able to apply it to your recommended plans, and you'll see what your actual out-of-pocket costs would be. Alex explains tax savings. I'll let you know that I use Alex every year. I never give Alex any of my W-2 information to give me a more accurate recommendation. But if you're looking to put money into a health account, Alex is at least going to give you an estimate as to what you would save. Another tool that we have to help you make an educated decision is the OptumRx drug pricing tool. Really, the key here is if you are taking any ongoing medications, you can put in the plan and see what those medications will cost you. We spend a lot of time going over the drug costs and talking about preventive versus non-preventive medication. If your prescription is on the preventive drug list, this tool knows it. So you will see the actual cost of the drug before the deductible is met, regardless of what plan you choose. Here, what plan you choose for the example. For those of you who might consider a higher deductible plan, just wanted to highlight the things that are included even before you meet the deductible. So everybody gets well-person checkups covered at 100% every year. Services and medications are discounted even if you haven't met the deductible yet. We've got the RX rebates applying at point of sale to reduce your pharmacy costs, and those preventive drugs do bypass the deductible to help keep costs down. This QR code takes you to the same place the QR code does on that 4915 booklet that you can get from Lori. When you visit this site, you're going to see all the videos that we didn't play. You're going to see all the handouts that are here, plus more. You're going to be able to get to the benefit booklet and the summary of benefits and coverages and all of those things that give you really every last detail about the plan. What's going to be very new for you this year is how you will make your elections, because at this point, I don't believe anyone is yet registered for benefits access because we have not yet told you how to do so. We are working on getting everyone added to our system so that you can go in and register and have a login for benefits access. And then benefits access is also going to have all that information that you can find on the AE site. You're going to have a personalized link to Alex Benefits Counselor, which Lori also has, and which we have in that 4915 booklet. And you'll be able to get to all the different plan details. When you log in, hopefully we'll get instructions out to you next week is the plan, in advance of annual elections starting on October 30th. So that should give you plenty of time to register and get your login credentials all set. When you go through annual election, you will see a running total of your premium credit. So as you choose plans, you will see the cost of those plans reduced by the premium credit. And then if your premium credit runs out because you've chosen plans that exceed that cost, which is common, you will see then what you owe, plus any personal contributions you've chosen to make. You will see that you owe. And remember, the premium credit only applies to plan premiums. So that's the combined medical, pharmacy, behavioral health plan, the dental plan, and the vision plan that you choose, not personal account contributions. And the amount of premium credit does not change based upon what plan you select, but will change based upon how many people you're covering. And then last, do not waive the premium credit. If you see that you're going through and a credit isn't being applied, I would first check to see if you've waived the premium credit. Sorry, it looks like some of you are having trouble downloading attachments in the chat. I will check on that in a moment when we start. In a few minutes, we'll be on the question section. I can take a look and see if it's a setting I have that I need to change. Do not waive the premium credit. If you do, when you walk through your benefits, it's going to look like you don't have any employer cost share. Don't worry if by some chance you go through it too quickly, you're not even paying attention to what everything costs, and you don't notice that you waive the premium credit. We will make sure we audit that on the back end, and you will get your premium credit. So annual election is from October 30th to November 14th. When you go through Alex, know that Alex does not make your elections for you. You must go through benefits access to make your own elections. When you go through annual election, you want to choose your plans, make your FSA and or HSA personal contribution elections if you choose. If you choose an HSA, you want to accept the terms and conditions. If you're in the DHMO, if you choose that, I would suggest finding a primary dentist right away. I'd honestly suggest seeing if you find a dentist in the network before you elect that plan. And if you don't make any elections during AE, you're not going to be enrolled in any plans in 2025. Now, we will send reminders throughout annual election. I think they are 10 days before it closes, 5 days before it closes, and 2 days before it closes. So you'll be getting plenty of email reminders to go out and make your elections if you haven't done so by those times. Need additional help. If you are having difficulty making the elections online, you can contact the AE Support Center. They're available 8 a.m. to 8 p.m. Eastern Time, Monday through Friday. They can answer some questions for you. They can also make your elections over the phone for you, or they can confirm your elections if you're not sure that you did it properly. So when we look at what we want you to avoid, avoid not using Alex. Please use Alex. Don't forget that you have to go to Benefits Access to make your elections. Recommend not choosing the DHMO unless you already know that your dentist is in network or that you found one that you'd like to go to that's in network. Make sure you approve the terms and conditions for the HSA. If you forget, we will send you an email to make sure that's what you intended to do. And don't elect a dependent care FSA thinking it's for medical services for your child, or if your children are over age 13 or you don't have an adult dependent that needs care. Here, just want to point out more to the right here, annual election again, October 30th to November 14th. Make your elections. Visit Alex if you need a recommendation. In December, the ID cards and debit cards are mailed. You should expect to see them between Christmas and New Year's. And then in January, your benefits begin. You can start calling a care coordinator if you have questions. You'll get information about well-being programs, and you can start using your benefits. And those dental and vision online cards, if you will, are available for you. So we think you'll love Alex. We hope you love the ability to choose the right plan for your household, that you have multiple dental and vision choices, and that health savings accounts give you the opportunity to put away more tax advantage money. So that is what I have. I'm going to try to now get some of these materials back in since they're not able to be downloaded. Let's see if I can. So there's 4915. 4915 should be available now. And I'll try the other ones and see if those are now available to people. So please try downloading again if you'd like. And if those don't work, we can send them out as a follow-up to this meeting, or you can use the QR code that's on that brochure in HR and download them. So now I'm going to go through. I do not see any questions in the chat. I am going to go through and make it so everyone can unmute themselves if you'd like. So feel free to ask questions. Feel free to also type them in if you'd rather. And then just so you know, I apologize that you can't download. That doesn't, I am not seeing anything on my side that would stop it. So I'm not sure what the issue is, but we will get those to you. Okay, so we will get those out to you. If you have any questions, please feel free to ask them. We're also going to have coming up, I want to check my calendar, make sure I give the right date. We're going to have a Q&A specific webinar that if you just want to call in during AE and ask questions, you will be able to do so. That is going to be Thursday, November 7th. So right in the middle of annual election, it's going to be 3 p.m. to 4 p.m. Eastern time. So if you have questions at that time, you'll be able to call in. We'll send an email out, or Lori will send an email out with the link. And if you have questions, I'll be happy to answer those. So I'll give you all a few minutes to see if you're formulating questions or not. Happy to answer those. Lori, did you have anything that you wanted to add while people are thinking about questions?
Not necessarily, but I did want to see if when we're done, if you and I could chat for about 5-10 minutes.
Sure.
Okay.
That's fine. Lori, are you able to download the
No, I was not. Some of them I know, some at least 3 of them are the documents you sent hard copies of.
Yes.
And several people have picked them up in advance of the webinars. Let's see. Let me go
So
back
strange.
Let me see if with the changes I can. It wants me to sign into Microsoft, which I did before. And then we're having trouble signing you in.
Okay, well, we'll get those out. I don't know. But we'll talk after, Lori,
Yeah.
on what the best way to get it out to people
Yeah,
would be.
5258. Actually, I'm looking at the hard copies I've got.
Yep,
And
you have
while
that
y'all
one.
are on the phone, 5258B is the HealthFlex plan comparisons. If you came by before the webinar to pick documents up, that was one of them. And if not, then I've got additional copies. And let's see. 4915B, same thing.
Yep.
So you either were able to pick it up, or if not, I've got some. And then 4937, that is for participants nearing Medicare eligibility. So I
Yep.
didn't put that out for distribution, but I've got plenty of copies here. And I don't know what 5465 is. But yeah, if you can send, if you
5465
can
is
eat.
finding a dentist. That's the finding a dentist.
Ah, okay. Yeah,
So,
maybe if you email me the finding the dentist and the what's the 5616?
yeah, 5616 is when to contribute to an FSA and an HSA.
Okay, I've got that one. So
Okay.
yeah, if you want to just send me the finding the dentist,
Okay.
I can send that out, and the others I've got hard copies of.
Sounds good. And then I just pulled up this page that has the QR code for anyone who's interested. If you scan this QR code, it's going to take you to our like public annual election page, and that has the plan comparisons, some upcoming webinars that are HealthFlex wide. So really a restatement of a lot of what we talked about today, just broken into chunks. It's got those benefit bite videos. And then all, drug pricing tool links, everything. So really, this is a good spot to go for all the materials.
Yeah, and I'll send that out with that link as well when I send the pricing.
Okay. Thank you. That would be great. Well, if no one has any other questions, I would like to thank you all again for joining and listening. I hope you found this a good use of your time. Please do not hesitate to reach out if you have questions or if there's something else that you need. And you should be getting information from us soon on registering on the website so that you can make your elections starting on October 30th.